Shashank,
Hmm.
let's others join. Our ECs are coming.
Yes, ma'am.
Yes, ma'am.
बताइए। जितेंद्र सर का दो दो प्लान है। इंडी का मुझे कहना वो दे दे। हाँ, ये जीते इंडी संतोष इंडी का।
Celebrating 100 years of spreading light, celebrating 100 years of care, of love, of hope, and of well being, celebrating 100 years of association, celebrating 100 years of the Trained Nurses Association of India. On her feet 24 hours a day, toiling endlessly, giving what comfort she can, caring and nurturing, giving shelter from the storm. Florence Nightingale, the lady with the lamp, the ministering angel, spread the light of love that still burns bright. Her lasting contribution has been her role in founding the modern nursing profession. She set an example of compassion, commitment to patient care, and diligent and thoughtful hospital administration. Carrying forward the tradition of selfless care and commitment, nurses today are the heartbeat of healthcare. And walking with them at every step and turning point is the Trained Nurses Association of India. A small band of visionary and pioneering women saw the need to develop nursing as a profession. The movement gathered momentum, and in 1908, a decision was taken to establish the Trained Nurses Association with the following objectives: upholding in every way the dignity and honor of the nursing profession, promoting a sense of esprit de corps amongst all nurses, and to advance professional, educational, economic, and general welfare of nurses. Today, TNAI has come a long way. With over 2 lakh nurses, 85,000 student nurses, 5,500 auxiliary nurses, and female health supervisors, TNAI has become a major link between nurses all over the country and abroad. TNAI's activities cover a broad spectrum of healthcare fields, growing by leaps and bounds by the year. In 1994, TNAI undertook the HIV/AIDS project in collaboration with the American Nurses Association. Then, in 2001, TNAI and UNICEF got together for a project on reproduction child healthcare. In fact, TNAI has been instrumental in launching National Safe Motherhood Day on April 11, 2003, in collaboration with White Ribbon Alliance of India for Safe Motherhood. Besides these, TNAI has collaborated with WHO, SIDA, CEDPA, Indian Red Cross Society, Indian Public Health Association, Indian Leprosy Association, and the International Council of Nurses, to name a few. Another feather to her cap is the Student Nurses Association, established in 1929. The SNA is a nationwide organization comprising of a vast student nurse members body with a wide variety of activities derived from the professional, social, cultural, and recreational spheres. The Student Nurses Association works in tandem with its mother concern, but towards the growth and propagation of glorious healthcare providers of tomorrow. TNAI is also lending a helping hand to the physical, mental, and emotional health of our senior citizens. An elderly care home and daycare facilities are being set up to meet not merely the physical need of the aged, but their psychosocial and spiritual needs as well. With an eye on the future, the Trained Nurses Association of India is working towards the setting up of a central institute of nursing and research that would coordinate and take forward the excellent efforts of nursing institutions and service centers. The objective of the institute is to take the quality of nurses and nursing skills to ever higher standards, with far-reaching impact on overall healthcare available to all in the country. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Through the years, the nursing fraternity has tirelessly, selflessly worked towards that overall well-being. From a small group of determined nurses to today's confident, well-rounded professional body, the nurses of today are raring to go. But the fight for a better tomorrow continues. With pride and honor in their past, self-assurance in the present, they look ahead towards a bright and promising future. After all, she is the hospitality of hospitals, the heartbeat of healthcare. A nurse always gives us hope, an angel with a stethoscope.
In the arms of the angel, you find.
Let's join together to celebrate that angel, her many forms, her many faces, her many graces. Let's celebrate 100 glorious years of care, for an angel looks down at us, silently smiling. Let's tell her 100 years have gone by, carrying forward her light. And let's promise her to carry it forward for many, many more centuries to come.
Thank you so much, Shashank. Now we'll start to share my slide. Thank you so much.
Yes, ma'am.
I hope it is visible, Shashank.
Yes, ma'am. It's visible.
Thank you so much, Jai Hind. A very good afternoon to one and all present in the screen for today's fourth day of our webinar series. We are very sorry to it start late because today was some programs regarding the International Nurses Day in all the EC members colleges. So just we have a point in our mind, why not to show the TNI what exactly the TNI is doing, because the TNI was running this webinar series. So thank you so much everyone to joining, and our blessings and gratitude towards all the nurses, all the frontline warrior who are working today, yesterday, and until tomorrow also for the safement of all the country members. Thank you so much, dear nurses. We all are with you. Thank you so much. TNI is giving full gratitude to all our nurses who are working for us. So this is our international webinar series for 5 days. We started on 7th and it is going to be in the valedictory session on 13th. That is the main topic is this time the theme is our nurses, our future, caring for nurses, strengthening economics. This time WHO thinks about the nurses also, that when we are happy, others will be happy. So this was the scenario of our speaker. Unfortunately, our today's speaker, Dr. Hardeep Kaur Mal, Principal, Baba Farid University, Faridkot, Madam is in the urgency of this bar situation and there is a fully blackout since 3 days. So in a hurry, I have already said yesterday that we will definitely have someone else. So today we have an international speaker with us. So we'll definitely going to introduce to Madam very soon. So the topics will be taken care by the international speaker. Before we start, I will go with this virtual lamp lighting ceremony as every day we are doing. So thank you so much. We'll take 1 minute to this virtual lamp lighting. Thank you. We'll go with the prayer.
गजाननं भूतगणाधिसेवितम् कपित्थजम्बूफलसारभक्षितम् उमासुतं शोकविनाशकारणम् नमामि विघ्नेश्वर पादपङ्कजम् गजाननं भूतगणाधिसेवितम् कपित्थजम्बूफलसारभक्षितम् उमासुतं शोकविनाशकारणम् नमामि विघ्नेश्वर पादपङ्कजम्
Thank you so much. Today we have our chief guest, Professor Rosalie Nirmal Madam. Madam is the Principal Max College of Nursing, Lucknow, UP. It was before Sahara College of Nursing. Madam is a well-known personality in nursing field, and today she is our chief guest. Let me take some opportunity to speak about Madam also. Professor Rosaline ma'am continues to work as a principal at Sahara College of Nursing under KGMU, that is now MAX. Her professional qualification include Masters in Obstetric Nursing from Chetram College of Nursing Indore, that is DAVV Indore, where she secured first rank in her Masters. Ma'am has also General Nursing and Midwifery. Madam is GNM from Kurjiholi Family Hospital, Patna. Later, she pursued for the post nursing from Dhamtri Christian College, Raipur. Her professional journey begins at Holy Family Hospital, Patna, where she served from 1989 to 2005 in various roles. Those includes clinical nurse, ward in charge, clinical instructor, and nursing tutor. During this time, 12 years with dedicated to the labor room, gaining extensive hands-on experience in maternal and newborn care. She was appointed as a vice principal at Sahara College of Nursing, where she served until 2017, and then after she promoted as a principal. In the addition, her academic leadership, she has been actively engaged as a speaker and resource person for national and international conferences, webinars, seminars. Ma'am has served as an external examiner for several prestigious universities, including BHU, Varanasi, IGMS, Patna, DAVV Indore, and Kanpur. And also, she has more than 35 publication, national and international, including PubMed Scopus. I request Shashank to unmute Madam. Madam is in screen, and I welcome you, Madam, with an open heart to say a few words regarding this webinar series. And we are blessed to have you here as a chief guest today.
मैम एक्चुअली किस नाम से हैं नहीं मिल रहे हैं.
Acha, let me check. Rosaline, ma'am, please open your video or raise a hand. I request Lakshmi Pandey to connect with the Rosaline, ma'am. Till that we are connecting with Madam, we'll go with our another guest of today. Yes. Let Madam join back. So we have today a very versatile personality, our guest of honor, Dr. Santosh Indi sir. He's assistant professor, BLGA College of Nursing, and he's a senior member, Rajiv Gandhi University of Health Sciences, and he is having more than 16 years of experience. As Santosh sir is currently serving as associate professor at BLDA College of Nursing, Tikoda, Vijayapur since October 2023. He has accumulated a total 16 of experience in nursing education with role in clinical instructor and academia, as he holds a PhD of community health nursing from Rajasthan and masters in community health nursing from Achay College of Nursing, Tumkur, and BSc Sri B.M. Patil College of Nursing, Bizapur. Previously served as assistant professor at BLDA Sri B.M. Patil Institute of Nursing and Sciences and lecturer at Marthwada Institute of Technology from 2011 to 13. As active involvement has been in nursing college established processes licensing with the Maharashtra University of Health Sciences, Maharashtra Nursing Council, and Indian Nursing Council. As he is elected as a Senate member in Rajiv Gandhi University of Health Sciences Senate election in 2024 with huge votes, authored the textbook of Introduction to Forensic Nursing and Indian Laws, language known as Kannada, English, Hindi, and Marathi, and he is specialized in teaching communication administration. And he have many publications, national and internationally. He organized many conferences, webinar, and seminar internationally and nationally. I request Santosh sir, kindly unmute Santosh sir. We welcome you, Santosh sir, for this webinar series. Thank you so much for having. We are just blessed to have you here, and thank you so much for accepting our invitation in a very short period in the morning. And you said, yes, I will be there, ma'am. Thank you so much for being with us today. Now we are requesting you to say a few words regarding the International Nursing Week celebration, about the TNI, and today's topic, evidence-based practice, means practice in the evidence section. Unmute, sir. We welcome you, sir.
Thank you, ma'am. So thank you all my professional bodies here. So first of all, wish you all happy Nurses Weeks to all. So I thanks to a TNA association from UP Lucknow for inviting me as a guest of honor for a wonderful international webinar on our nurses, our future, caring for nurses strengthens the economics. That is true. Because, is it audible to everybody?
Yes, yes, sir. You are well audible.
Thank you. So, the WHO has given, and this Nurses Day, the theme has given, that is our nurse, our future. And here to the theme is awareness, our future. What I've given is it's a wonderful, and there's a meaningful is there. See, already in our India, there are nearly 3.35 million nurses are registered as a nurse and midwives, but total population is 1.4 millions are there, 140. So take the scenario, that ratio of that, there will be 3 nurses for 1,000 population. How in rural area, in peripheral area, for 1,000 population, there is 1 ASHA worker, no? So like that, the scarcity and deficiency of nurses are more in India, even in abroad also. Even the current statistics, we need another 3.4 million nurses are required in India to serve the in both service side also and even academic side also. But the matter is came here, we have to empower and we have to strengthen the economy of nurses, and where it is very necessary, being a huge community in India where we are serving to the patient. How we have to empower and how we have to make this strengthen in economics. The first, we have to give a value to the nursing fraternity first and foremost. As take to the scenario of the previous in your ancestor year and 100 years ago when our Florence Nightingale was introduced this nursing profession. So now there is a drastic changes are there comparing to previous to at present, and still we required a value for the nursing profession in all the aspect, and even we need some of the support and strengthen for the nursing profession build. If we get these 3, definitely we can give a better care to the patient, because the 90% work has done by the nurses to heal the patient in their crucial period. That's why WHO says that the nursing profession is the backbone of healthcare delivery system. So not only for valuing and supporting, now I appreciate this TNA state branch of UP, and especially my best friend Dipti Shukla madam. She is very active and entire her team is very active. I met madam last 2 years back in master training in research lab that INC has sponsored. So here I'm observing and I'm following the madam's all updates in social media. Just to conduct all many research activities and everything, because now today's topic is evidence based practice. The previously ancestor, how that traditionally they are taking care of the patient, it has gone now AI system has adapted. So we need these all high technical advice and study materials and such webinars, such conferences and everything. Really, it motivates to all the trained nurses also, and even student, the nurses association also. It will be very helpful, and I appreciate the state branch of TNA UP are taking very good initiation, even though here we need a nursing fraternity, not only in academic or service side betterment, even overall betterment is needed, because here we have to strengthen economy, means not only in this academic, even the many things have to be done. Being a huge community in India, comparing to other, according to the statistics of present in medical doctors are only 13,86,145 the registered medical doctors are available, but ours is 3.35 millions. So comparing to this statistics, we are the huge community, but still we need some support from the government of India and respect to all the states to make that the empower the nurses. How? recently, last 3 years back, when semester system has started, that this INC has such a beautiful syllabus where it is needed. All the nurses has to get this skillful, even teacher and everywhere, everything. So I seek the and I request the all our apex body like the state council and state TNA representative and even representative of particular university come forward and give your contribution and make involvement in betterment of in skill, because on this dais I appreciate our Rajiv Gandhi University of Health Sciences Bangalore has taken the very good step for improving the
Ma'am, join
skill.
join
How
करिए ma'am.
this Indian Nursing Council has initiated that simulation lab in Gurgaon SGT University. The same, our RGHS has taken step for all 5 regional centers. They have started. They are going to start now simulation lab and even skill lab also. I request Deepthi madam, start from UP only, even not from only council, not from only RGHS, because our community is more. In Karnataka, we are having 687 nursing colleges. That is purely degree colleges. And GNMs are 800 plus colleges are there. So 5 simulation is sufficient. The same way in everywhere, the TNA also has to take initiation for making that. And I have come across in my Karnataka, the TNA benefits, the many students and teachers are they don't know what are the benefits they are getting after becoming the membership of TNA.
Yes.
So being this huge,
दो लोगों को
how we can tell in general politics, how RSS and ABP, they have made a very big association, even though this is the one association in India, the very biggest and very highly qualified association, that is Trained Nurses Association India. So I request make strengthen in many aspects, establishing many simulation lab, conducting, and even though this is academically part, we can strengthen and we can give better care, and we have to make our profession and build very strong to make some policy making. We should be a policy making. The government of India, there is a one joint director post in each state, but still that posts are held by the doctors. This is very pathetic condition. So I urge all our professional bodies like our Deepthi Shukla madam and the president of TNA India national level, Annie madam also. From this days I request, so please make a one unity, make a one appeal where in each state there should be a one joint director from the nursing aspect where they can take care of that. Not only that, and being a huge number of colleges, being a huge number of nursing fraternity, we should have our own independent nursing university. It is not there in India. So I request you all from this dais, so please join your hand with me. We are going to take initiation to have our independent university, and even the many branches are in India, they are starting to rewarding and awarding our nursing profession. That is Florence Nightingale Award. So with impress of this one of the state branch of our India, this TNI, they are giving in all the sectors, service sector, research sector, academic sector, and everywhere they are giving the Florence Nightingale Award. So this year I'm planning through I have established one association that is empowering the Professional Teacher Association in Karnataka. We are planning
nice.
through that association to give Florence Nightingale Award from each district, 2 members, one male and one female, where we can award, where we can motivate our profession and to empower. So through this, we can urge to our apex body, INC, to make a regularize our salary where it is not properly mentioned, and it has to go to UGC and to make some fixed salary like a AICT scale like that. So really, in all the aspect, we can empower. And then I feel this slogan, what team has given to empower the economic of the nurses, then it will be fulfilled. I feel that. So I appreciate once again this TNI of State Branch of UP. Really, you are doing very wonderful programs for awareing regarding research and many things also. So I, even though we'll motivate in Karnataka also to make this happen, and even my best suggestion to all my trained nurses association, don't be stick on only in academic side, in service side and everything. So come forward for the making some innovations in research aspect and be the part of policy making. And even I'm very happy in this team of UP TNA association. Two my well-known members are there. One is Deepthi Shukla madam, another one is Rahul Sharma. They both are my research mate, can say, in that master trainer mate, we can say. So come forward and be in policy making. So how we have proved in Karnataka, RGHS is established in 1996. There were 10 election were taken place, but in 2018 we elected one nursing profession, one Senate member from the nursing profession. This time 2020 we elected two Senate member from the nursing fraternity. Out of 5 other than professor, 2 are from nursing fraternity. I promise in 2027 all 5 other than professor will be there from nursing fraternity, should be in policy making, and within 10 years there should be an independent nursing university for the nursing fraternity. So be in the part of policy making also. I thanks to Deepthi Shukla madam for inviting me as a guest of honor and giving me an opportunity to share some few words on this beautiful occasion. I thank you all, organizing committee and TNS State Branch UP.
Thank you so much, sir. Thank you so much, Santosh, sir, for really your motivational and enriching words and the ideas which you still started. You already started in the state of Karnataka, and definitely we are taking all your words with us, and we, the TNI UP State Branch, definitely work on those things. And I'm really very much glad and happy and proud of your friend, as you are really thinking about the weak point of the nursing ladder, whether we are the education side and the clinical side. As you focused on the simulation section, TNI started working on that. They have the biggest lab in the Noida, and they start to planning to work in UP, and definitely on 13th they're coming, I think, for the same thing, and something is going to be happen. So jaldi jaane ko, you will get to know this thing. But yes, I really appreciate your work, and from the day you joined the CNET, you become the member, you started working for the nurses. I also used to go through with all your posted, and every time I appreciate you that yes, you are a true leader and you will take nursing profession far away somewhere. You definitely are going to do some miracle in the field of nursing profession. I really appreciate your work, and I'm really thankful to you that you joined us. And today, the nurses who joining in this webinar series and they are listening you, they will definitely understand, yes, nurses are like that. When we will be together, we can do something. Because of we are the foreign here and there, means we are discarded from each other. When we'll join together, we will just going to be a rock everywhere. I request all the nurses through this panel and through all the nurses, you can pass on the message to others. We need to be have a good bond with each other, and we can join together our hands. When we are joining in organization, see, one person, if you're speaking, not work out. As you can see, Santosh Indi sir, he joined one organization, and now he's a voice of everyone. The nurses working in the Karnataka through the CNET, and he's putting all the points of theirs from one person, and having all the voice of other nurses in the Karnataka, same like that. If you are joining with one organization, definitely together we can work, and the voice will be from the organization. I request each and everyone, please join some organization, be the bond of the nurses, be the proud of the nurses, and we will work, we will definitely work for us. Thank you so much for your beautiful words, your motivational words, Santosh sir. Definitely we are going to take it. We all love you, sir. Thank you so much for being a part of today's webinar series. Next, as your words goes to the simulation, today we have a star guest with me. The point is the simulation, and he is the master of that. So today we have a star guest, Professor Jitendra Singh, Professor
Thank-
Samarpan, Department of Medical Surgical Nursing, Tithankar Mahavir University, means Tithankar Mahavir College of Nursing, Muradabad, UP. Professor Jitendra Singh Sikhawat, sir, is currently serving as a professor and head of Department Medical Surgical Nursing at Tithankar Mahavir College of Nursing, Muradabad, Uttar Pradesh, holding 18 year plus experience in nursing education. He is occupied including 16 years post his MSc teaching and his MSc in medical surgical nursing completed from Rajiv Gandhi University of Health Sciences, Bangalore in 2009. He's a PhD in nursing presently being pursued at the Tithankar Mahavir University itself. His leadership roles have held as assistant professor, principal, coordinator at Government College of Nursing, Jammu, and vice principal in Rajasthan. Professor Singh has actively contributed to curriculum development in the NAC coordinator and clinical supervision. As served as a research guide, examiner, and paper setter for the various universities. He is registered with UPNC, TNI, AHA, JINRA, and recognized as a BLS and ACLS instructor. As the research contribution includes 7 peer-reviewed publications he already completed, covering topics such as stroke awareness, blood-borne infection, MDR, TB, and cardiac rehabilitation. Multiple national and international conferences, seminar, and workshop has been organized and attended, including session on simulation, nursing research, and digital health by Dr. Professor Singh, known for his dynamic role in organizing academic events, including national conferences, international e-seminars, and skill-based training. The core teaching expertise is medical surgical nursing, research methodology, nursing management, and simulation-based education. Sir is a trainer for simulation-based education in Tithankar Mahavir University. Just like yesterday, we met LB sir. LB sir, he is same like that. He's also training to all the masters in nursing, BSc nurses, MBBS, PG, means all over the people who need this and who are born to do this ACLS and BLS trainings. Sir is a trainer for them. I usually, with the bottom of my heart, I welcome Professor Jitendra Singh Shekhawat, sir. Sir, thank you so much for joining us and making this event wonderful and blissful. I request Shashankar kindly unmute Jitendra, sir. And sir, please share a few words as you are a fantastic nurse also. You are giving life to many and many. You are a role model for many. We will love to listen from you for this theme of this year of International Nurses Day and definitely our webinar series. Yes, please.
Okay, thank you very much. Am I audible to all?
Yes, you are valuable, sir. You are valuable.
Yeah, good afternoon, everyone who are present here. I'd like to extend my heartfelt thanks to organizers of TNI State Branch UP, especially Dr. Delhites ma'am, for inviting me in international webinar series on our nurses, our future caring for nursing strength and economics. As we know that we are celebrating here the International Nurses Week, we honor the invaluable contributions of nurses worldwide. We know the nurses are the backbone of healthcare system globally. They embody compassion, expertise, and resilience in their daily work, often going beyond the call of duty to care of the patient. They also work in critical situations like COVID-19. Beyond their critical role in healthcare, nurses significantly impact the economics also. They contribute to economic growth through their by preventing illness and promoting health education. Investing in nurses' education and work, we can definitely development not only enhance the healthcare outcomes, but also strengthen the economics of our India, our world. To stability of creating jobs in nursing, it definitely is driving the innovation in healthcare delivery system. Let us a place to recognize the respect and empower our nurses. Their unwavering commitment to patient care and public health is a testimony to their importance there. In this occasion of International Nurses Week, let us celebrate our nurses, honor their achievements, and reaffirm the commitment to their well-being and professional growth. Thank you to all the nurses to dedication service. Together, let us continue to advocate for a future where nurses excellence thrive, breathing in society and economic alike. So happy International Nurses Week to all. Thank you very much, ma'am, to invited me here. Thank you. Hello.
Good. Thank you so much, sir, for being the part of this webinar series and being with us. And you are such a role model for us because you are giving so much training regarding simulation as talked by Santosh Indy, sir. Thank you so much, sir. Next, I welcome our special guest today. Yes. Professor Suchita Roy, Assistant Professor, Government College of Nursing, Tehri, Uttarakhand. Madam Roy is a PhD scholar and TNI member. She is having a training in the simulation-based education. She organized many international and national conferences, seminars, and workshops. She's a gold medalist in masters by HNBMW, that is the Government College in Dehradun. Best Teaching Faculty Award by the State College of Nursing on the occasion of 12th May 24. Best Nurse Award from UK, that is Uttarakhand Medical and Family Welfare in 2006. Thank you so much, Sucheta Roy, ma'am, for being the part of this webinar series and our special guest. As I know you since 26 years, you are such a brave nurse. I can say that you started your journey same like me as a GNM. Madam is my senior in general nursing and midwifery, and now she is working as assistant professor on Hill Station and saving so many from there. I request Sashanga to unmute Suchita Roy, ma'am. And ma'am, I request you kindly share your few words regarding the nursing profession, uplifting of nursing, and the this theme of this year and this webinar series topic. Thank you so much for joining us. Kindly unmute Sucheta Roy.
Thank you so much. Thank you so much, Dr. Dipti Shukla, ma'am. So good afternoon to all and all present here. I am Mrs. Sucheta Roy, Assistant Professor, Government College of Nursing, Tehri, Uttarakhand. It is a proud privilege and honor to be here on the occasion of International Nurses
Excuse
Day
me, ma'am.
and
Your
the
video is.
celebration of International
Excuse me,
Webinar
ma'am.
Series.
Your video is not visible.
Yes, ma'am.
Is there any problem with the network? We are not able to see you. Yes, now we are able to see you. Yes.
Got it, ma'am?
Yes, ma'am. Please go ahead.
Yeah, got it, ma'am?
Yes, ma'am. Yes,
Okay.
ma'am.
Thank you so much. Okay. So should I start?
Yes,
Okay,
yes,
so
yes.
to all and on present here, I'm Mrs. Sucheta Roy, Assistant Professor, Government College of Nursing, Tehri, Uttarakhand. It is a proud privilege and honor to be here on the special occasion of International Nurses Day and celebration of International Webinar Series, Evidence-Based Practice. I extend my heartfelt gratitude to outstanding institute, that is Samarpan Institute of Nursing and Paramedical Science, Lucknow. And of course, respected Dr. Dipti Shukla ma'am, she is invited and recognized as a special guest during this meaningful celebration. So moving on to the theme, that is the year that our nurses are future, caring for the nurses, strength and economy. So here, it is not just just a message, it is a call to action. It is a challenges us to recognize that nurses are not only the heart of our healthcare system, but also the economic delivers of healthier, stronger, and more resilient communities. Let us be clear, nursing is not a cost, it is an investment. Every nurse on the fortunate reduce hospital stay, prevent from the diseases, promote from the wellness, and provide to the human touch. That there is a no machine or algorithm can replicate. As we face global health challenges from the pandemic to chronic illnesses, but the nurses are our most valuable resources. But to unlock the full potential of the nursing, we must invest in their education and working condition where the nurses in their society. And on this day, let us not only for express my gratitude, but also commitment to change. Let us raise our voice to ensure that policies are made with nurses at the table, that their contribution are respected and recognized, and that is the power of care is placed whether it belong at the center of progress. So, as our international web series, that is evidence-based practice. So, so what is evidence-based practice? Evidence-based practice in nursing involving using the best available research evidence. There are lots of platform is there as a professor professors in earlier time tell to us that there is a simulation. Yeah, we can use a simulation while doing any fundamental practices, when we are doing any practices, when we are doing any demo procedure to the student. Next, along with the clinical expertise and patient preference to make the informed decision about the patient care. So, I would like to say, included me also, thank you so much for your courage, your compassion, your commitment, and you are only for the backbone of the healthcare system. You are the architect of the healthcare and more equitable world. Happy International Nurses Day. And one more verse I would like to share in front of you all, that Dipti Shukla ma'am right now told to us that we know each other in 26 years. She is a very dedicated person in her profession. I see every time. Of course, I was her senior, but definitely never deny that she is so hard working, so dedicated to their profession. So that's why we can talk that we can also talk to her that she is right now self actualization. I can say this kind of word to Dipti Shukla ma'am. So thank you, happy International Nurses Day. Thank you.
Thank you so
Thank you,
much,
ma'am.
ma'am, for your words. Somehow we missed some words as your network was not good, but we understood your feeling towards the nursing profession. You are such a wonderful nursing professional, I could say. And she's sitting more than 250 kilometers away from the base, means on the top of the hill, and serving to the society. Thank you so much, ma'am, for being the part of this webinar series. Next, I would like to welcome first our today's speaker, Dr. Prema ma'am. She's Assistant Professor, College of Nursing, University of Hafar Al-Batin, Kingdom of Saudi Arabia. First, I will like to thank to Madam, as we were in the crisis and our today's speaker was means born in this war section. So thank you so much, ma'am, that you received our request and you just said yes, I am ready for this. This time we can say that the nurses are the lifeline, and you become the lifeline for the Tina UP state for this webinar series. So, Madam is having more than 20 years of experience in nursing education and research and have been accumulated. Currently, she is working as assistant professor at University of Hafar Al-Batin, Saudi Arabia since October 2019. Prior leadership role have been held as a professor cum principal at various reputed nursing institutions in India. Madam is PhD and master scholar, have been mentored, contributed to the academic and professional development of future nursing leaders. She is a research supervisor and has influenced advancement in nursing science, promoting critical thinking and scholarly inquiry. International conferences have been addressed as a speaker on themes including nursing professionalism, digitalization in nursing, telemedicine, and research innovation. An international postdoctoral fellowship was awarded by the University of Burin, funded by the Sigma Theta Tau International and International Doctor Network, published more than 80 articles nationally and internationally. Thank you so much, ma'am. We welcome you for today's session. And without wasting time, I request Shashank Gar to start this session and share the PPT from Madam's sides and with Madam. I hope she is here on the screen as I am not able to see. Madam is there.
Yes, ma'am.
Yes, ma'am, I'm here.
Ma'am, a very good afternoon. Thank you so much. We all welcome you. And after this session, we'll discuss about more things with you. Thank you so much.
Thank you, Dr. Deepi ma'am, for your introduction. And it's always pleasure for me to join with you in hand. And
Ma'am,
thank
your
God at
voice is
least
very
that's-
much low. Your voice is very much low.
It's okay now?
I hope, I hope. Please, anyone from audience or any teacher, please confirm voice is audible to everyone.
Yes, ma'am. It is
Hi,
audible.
everybody. Its voice is audible?
Yes, ma'am. Audible.
Okay. Hi, everybody here present here. And first and foremost, I would like to thank Dr. Deepi ma'am for giving me the chance to be a part of this event. And by God grace, at least once in a year, I join with Dr. Deepi ma'am. She gives a chance for me to address my fellow colleagues in India. Thank you for that, ma'am. And I address this with a very good afternoon to the Train Nurses Association of India. I take the privilege, and this is a time for me to present my gratitude for the President, Vice President, Secretary, Joint Secretary, the Treasurers, SN advisors, chairpersons of different committees, Membership Committee, Program Committee, Nursing Service Sections Committee, Nursing Education Committee, Public Health Nursing Sections, and the Economic Welfare Committee, and others, whomever is present as a committee members. And also I extend my thanks for the guest and the special guest, chief guest, guest of honors who has joined today to make this international webinar a very, very successful event. Fine. Going to the session, I want to know whether my slides are visible for you. Slides are visible.
Shashank, make his slides share. Make it slides share.
मैम शायद मैम ही प्रेजेंट कर रही है आई थिंक.
अच्छा, ma'am present
Hey,
कर रहे.
ma'am.
Okay.
Yes,
Ma'am,
I'm
make it
presenting. I want
No,
to
ma'am.
slide
know
share.
whether it is
Slide share we
visible for you.
needed.
I
Come
can
down.
share.
I'll
Just
do
We
one
needed
thing.
slide share. Yes.
I can share, ma'am.
I will
Actually,
stop
ma'am,
my
it is
sharing.
only
Please do
half.
continue.
We can see half slide of you. So Shashank will share from his side. So it will be full screen. Yes.
Yes, ma'am.
Yes, ma'am. You go ahead. Thank you so much.
Thank you so much, Mr. Shashank, for this. Can I have the next slide, please? So as an introduction, I'm Prema here, who is working as assistant professor in University of Afral-Bati. And today we are with the topic, closing the gap from evidence to action. So we all know what is the evidence-based practice. It is an integration of research, clinical experts, and patient-centered approach. It is here saying that it is not that what we have always done. The evidence-based practice is, it is what the evidence shows work best for today. It's not that I have done, my senior have done like this. 10 years before, my PNR has done like this. This was a practice what I'm having, so I will be having the same thing. No. Today we are under the research integration with the various scientific findings, and we collaborate that with the clinical expertise, and always we keep our stakeholders patient-centered approach. Next slide, please. And here we have here, which is helping us, as we have seen, the three different pillars which is present under the evidence-based practice. Best research evidence, and this best research evidence, how we are making it. We know the level of evidence what is present in evidence pyramid, and we go always concentrate towards the first level of evidence, that is our meta-analysis and the systematic review. And with the help of that, with professional judgment and through the experience, through the educations, keeping the individual values, concerns, and expectations of the circumstances, we are choosing the method which is very essential to my area, which is essential to my place, which is essential to my scope, in order to obtain a good, efficient patient outcomes. So these American Nurses Associations emphasize that successful evidence-based practice requires for us so to develop skills in all three domains. When we are developing the skill in all three domains, then effective implementation of evidence-based practice is going to happen. And following the next slide, if you're seeing, here we have the informations related to, can I have the slides please? The evidence to action hub, why it exists, why at all there is a gap is existing. Because the research conducted in a control setting, and we have some barriers when we want to convert the theory into the practice or the result in the practice and in the evidence into the action. And also we have to concentrate towards the real world healthcare delivery. So always we describes the implementation science challenges is taking place in adapting proven interventions to different contexts for the patient's populations, for healthcare systems with varying resources and the priorities. So this is where we see that there is a gap is present. In order to fulfill this gap, what we have to do, what is the impact is going to happen? Because of this gap, the impact on gap on patient outcomes, 70% of the preventable harm, the percentage hospitalized patients experiencing, that can be prevented. And the annual cost what we are spending towards the medical errors can be prevented. And also patients not receiving recommended evidence-based interventions are for about 30% is present. So this is a report is giving us information saying that the healthcare resources creating unnecessary suffering and financial burden. To overcome all these things, we have to see that the gap is filled. Imagine ourselves in one area of the one side of the things, we are bridge, we have all the data which is present in our hand, which will be the best effective way. Another one side, we have the patients, and you see the trends, what is happening. We are all enriched with the morbidity and mortality rates, and our aging populations is increasing. So to cope with, we have to provide the evidence-based practice care. And we nurses are in between the bridge of the patients and as well as here with the data. And we are here transferring the data towards the patient to meet the gap, to fill the gap, and also to achieve the, what is our aim? Patient safety. Our aim is always see that we are providing the good patient outcome care. Okay, this evidence-based practice, from where it started. And today we all gathered here to celebrate our International Nurses Day on May 12, and we are under the series of the webinars which is organized under the heading. And here if you are seeing where we started in 1850 during the war, when there were the increase in the infections rates were present for the soldiers, Our Lady with the Lamp. She is the one who has started to improve the sanitations to reduce the mortality. And she is her meticulous data collection, her analysis, the data, what she had as an evidence with her, showed the information saying that, see, my dear health professionals, this is the data what I'm having, evidence what I'm having in my hand. And this evidence gives me the information if we are increasing our hygienic practice, sanitations, and definitely we are going to decrease the infection rate. Put the evidence into practice. And if you see the infection rate from 42%, it came to 2. This is where we have taken in the year of 1850s. And it is followed by 1890s, 1990s, and 2000. And today we are standing here in the position of organizing the events with related to the evidence and organizing the events, and we are also streamlining and we are enhancing each and every young leaders, those who are present here, to put the light towards the evidence into the practice. And we are here to fill that gap. This is the historical roots of evidence-based practice in nursing. And followed, if you're seeing, if we are practicing the evidence-based practice, what is the benefit we are having here? See there, patient satisfaction, followed by patient safety, and nurses satisfaction, followed by cost reduction and the length of the stay. So when we go for the evidence-based practice, we see that this is a miracle is happening. One such evidence-based practice is using the electronic health record system under our nursing practice. This electronic health record system have brought the medical error, have brought the patient's harm, increase the patient safety in such a way, the patient satisfaction, patient safety is having its own increasing level in the way of providing the good efficient care. Next, we are saying about with the benefits of this implementing evidence-based in nursing. The next slide. Having some examples where some of the projects they have used and they have implemented and they have reduced the pressure injury, early mobilization. And we have some models such as hygienic model, hand hygiene program conducted by John Hopkins. And similarly, we have the AHRO, which is the Agencies of the Health Research Organization. And they have used the model comprehensive unit-based safety program. These are all the evidence for us, which gives us the information that this evidence is used in the practice and this is the way how we are filling the gap. But still, gap is present. Let us see, we are seeing, we are using that, we are using this. Is the gap is present? When we check about whether the gap is present between the evidence and to action, next slide. We are here with barriers. What are the barriers is here? Individual factors. What is that? Knowledge gaps, resistance to change, comfort with status, team dynamics, there is no good communication, lack of interdisciplinary cooperation, organizational barrier, insufficient resources, system-led obstacles, regulatory constraints. So here if you are seeing, the system-led obstacles is the base, which is giving the factors for the other barriers. So as an individual, how we can overcome this? How I am going to overcome this as an individual? How I am going to fill the gap? Put yourself, whenever the organizations, big organizations like trained nurses associations and other organizations, when they are organizing the activities, involve yourself as one of the member. So you will be coming to know what is the update is present. And that will help you to trigger your mind. It gives you energy to move towards the what is the update is present and where you have to reach. So how I can assess the readiness for evidence-based practice adoptions? Here we have readiness. Then organization infrastructure should be supportive and cultural readiness should be present. And leadership support is very important. These evidence-based procedures will be helping us to go through the readiness assessment before we are implementing. If I am not having the interest, then how I am going to put myself in filling the gaps or using the evidence in my practice? Do you think the closing the gap is a task for tomorrow? No. It is a responsibility what we have to follow for today. Coming to the next. What is the essential skill is needed? Locate where you can get a research effectively. Have the knowledge, practice and skills to critically appraise. It's not all the published articles is going to be, all the published evidence is going to be helpful for you in the practice, because the evidence is giving us the information saying that it takes time. And also it is very difficult for us when we are putting that into practice. So for that, we should know the critical appraisal. We should integrate the findings. And also we have to adapt the evidence to the clinical context. What is the framework I can follow if I'm interested to follow the evidence-based practice in my place? First of all, in your place, your observation, your experience should give you a thought process that for this particular problem or this particular solution for these issues, I need a solution. When that process is coming, you can follow either the John Hopkins model or the lower model or the Paris framework. Whatever model we are going to follow, first and foremost, what we have to have in our mind is a PICO. When we start with the PICO, the patients or the problems, the interventions or the comparisons or the outcome, this is going to be the base for us to create, to generate, to bring the evidence towards the practice. Coming to the next, what's the role of nursing leadership in closing the gap? The leaders, those who are present in the TNA Association of Uttar Pradesh, have taken the charge in their hand to close the gap. Their vision in organizing the international webinars and the resources they have taken in hand and the recognitions what they have made, and they are having the performance metrics. So here, this demonstrates the leadership behavior significantly. This influences, this commitment, this leaderships is emphasizing to have transformational leadership. Today, the team which is present under the TNA Uttar Pradesh is a transformational leadership. The guest and the chief guest and the guest of honors were giving us. This is a very biggest organization which is present here. Active organizations in comparing to India and the other states. Active organization which is holding the things. And also Dr. Deepti ma'am was giving us saying that soon, very soon, we are going to fill the gap, bringing the simulations towards the Uttar Pradesh from TNA. So these all gives us, these are all the evidence for us. The transformational leadership group is holding the TNA team under the Uttar Pradesh, who is inspirational, who is a motivational, who is intellectuals, who is individualist control, and they create the cultures to have the evidence-based innovations. Coming to the next, role of the professional development and training. I'm looking forward this organization that they will be holding the training sessions towards the evidence-based practice, such as like the Cochrane, if you're seeing, they have the evidence-based training sessions, systematic reviews protocols. They have 1 week programs where they give the training towards the health professionals. As we are associated with the different activities we have started, maybe we can start with these evidence-based practice trainings we can give from your branches. So in such a way, we can have a basic literacy, we can have an advanced critical appraisal, we can implement the scientific training. This helps us to fill the gap. We start from here. The filling the gap in the sense, start from here, incorporating the knowledge, start from here, streamlining the knowledge, start from here, building the advanced critical appraisal, and then automatically implementations is going to happen. Next, we have here as partnership with patients for better outcomes. Whatever we do, this everything is towards the patients. Patients is not somebody third party. We are also under the group of the patient. So here, the patients as a partner, moving beyond the patients as the passive recipient of care to active participate in the care. How I can implement it? Decision aids based on the current evidence, patient education's materials in multiple formats, and patients' representations. The patients nowadays comes to the healthcare with the informations. Even they use the evidence-based practice by the form of the social medias. They have the information in their hands and they come to us and they demand us and they verify us. They have the yardstick whether we are in a proper line, whether we are updated. So such level we are with the innovations things are present. When such is the case, the Patient-Centered Outcome Research Institute has demonstrated that including patients in any activities is helping us to have the better care. So what is the technology and data and evidence-based implementation? As I told you, the electronic health record integrations, the data analyst for the practice improvement, the mobile point of care resources. Why we want all these things? If you're saying one of the challenge we say here, I have a time, 12 hours for my duty. And this is also here, we have a factor saying that we are workload. We have more workload, we have the stress, we have the humilities, we have the challenges. When such is the thing is present, how at all you are expecting us to see that we have to implement the evidence-based practice? How we can implement or fill the gap? The mobile point of care resource is one of the aspect where we can use it as one of the strategies. Going to the next. Here we have here, overcome the barriers. The research in the year of 2021 identified so many effective strategies to overcome this, such as we can have journal clubs where we can meet regularly, at least as per the, so 64% is having also administrative staff give the 58% of the one research articles or one evidence is there for us to implement in the practice. It takes 17 years to make that evidence into complete practice. It takes 17 years. So that effective practice or filling the gap, how it can practice it well in the sense it's purely by our interest, by our skills of thinking, by our creativity, by our strategies, we can do that. And effective leadership's team should be present. And the organization should support. It's not an individual hand. So what is the recommendations? In the organization level, leadership, department, individual, patient, family we have. Under the organization leadership, establish clear evidence-based vision. So what is going to happen? Sustained organizational commitment. Under the department, deploy evidence-based practice. Under the individual, set personal evidence-based goals. As a patient and family, include decision-making, provide evidence-based education materials so that it is going to help us to fill the gap. Coming to the next slide, knowledge to action. So today we have gathered here on the event of the International Nurses Day. And every nurse is the evidence-based champion. And every nurse, collaboratively, we have to implement to make our discipline irrespective of the barriers. And we always should see that using a framework, evidence-based framework, and our activity should be on patient-centered focus. So coming to the theme, if you are seeing here, how it is going to be connected with our theme. So our theme, if you are seeing, it is towards caring for nurses, strengthen the economics. When we are caring for the nurses, because the nurses are having the challenges in the work area, the nurses are having the challenges in the different stakeholders with the patients or with the colleagues. We have different challenges in the form of the, so we are not able to balance the work-life balance is not present with us. So in order to maintain the work-life balance, we have to see that at least $1 of the investment is done in the name of the nurses, in the sense it is going to be returned back to the country in the form of $2 to $4. So the 1%, what is it 1%? The 1% is provide a good environment in the work area or provide the good equipments and supplies. So many areas, water scarcity is present, PPE is not present. If you are able to provide that adequately, and if you are having some work-life environment, balancing environment in the work area, that will influence in providing the care towards the patient. When we are providing the care towards the patient rate of overcoming, the rate of recovery is increasing. When the rate is increasing, there is no question of readmission, there is no question of the increasing the rate in the admissions towards the patient. In such way, the country's economy is reduced when we concentrate towards the nurses. And here the mental health issues is also having a very important factor. To overcome that mental health issues, I think here we nurses are present for around 70 colleagues are present here in this group now, who is actively listening here. Okay, I'm an individual person.
No, ma'am.
How I can
They are 72, but more than 3,000 students are already joined in the group, and they are sitting in auditorium and classes in different colleges.
Thank you so much for filling the gap, madam. Your information have filled the gap.
Thank you so much, ma'am.
Saying
Thank
that thousands and thousands of students are present here. Fine here. So when thousands and thousands of students are present here, let us we see as an individual how I can be a factor in increasing the evidence-based care. Yes, we can be the factor in providing the evidence-based care first by taking care of ourselves. Self-love is the first thing what we have to do. How many of us are having the rest and sleep? How many of us we take care of ourselves from and to be relax yourself? This 5 minutes activity, what you are going to follow from today in your day-to-day activities, it will enhance your body, your mind, your factors, which indirectly going to help you in your work area. That is going to help you to the patient care, and such way you are the hero and you are the future in making the team in a perfect by strengthens the economics. So future caring for nurses strengthen the economics. So let us we start for a few minutes. I request everyone to be relaxed. Ready? Can I have some hi in my message so that I understand that everybody is ready from some group? Hi, Dr. Jasim Johnson. Thank you so much, Doctor, for your participations here. I could see you here. So let us be relaxed. If you're having your mobiles, keep the mobiles aside. If you're having any note and paper in your hand, keep that aside. Sit relaxedly. From top towards the end of the foot, you're going to sit relax. I'm going to tell 3 times relax, relax, and you're going to relax completely by taking breath in and taking breath out. And just you're myself. I'm taking a breathe inside. I'm breathing out. I'm doing the second time. Breathe inside, breathing out, breathe out, then close my eyes. Let us we have a backward count from 10 to 0. Join with me. You can say louder along with me. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Thank you so much for all of you. It's a hand for a clap for you, all of you who has joined here. Why we have to do this? If we have control on ourselves, then it is easy for us to have resilience. The resilience is the important factor which is needed for us today, where it will be helping us to overcome the challenge, to face the challenge. If I'm having the resilience, all the equipment supplies will be present in my workplace. No. Resilience is a vaccines like for you. It is an umbrella what you're having in your hand to protect yourself from the rain. So when you follow this 5 minutes, breathe in, breathe out, or when you follow this counting whenever you are having the tensions, whenever you station, and or either before bed or the morning, your brain will help you how to overcome, how to maintain, how to create the positive energy, because you cannot pour from an empty cup. So first we have to take care of ourselves. With this again, I take this opportunity to thank all the individuals who has given me the chance to deliver the speech here. I could recognize my fellow colleagues. I could see the colleagues where I have worked with them together, especially like Professor Jitendra Singh. And also some of them who have joined here in from Muzaffarnagar, Muradabad, send me the message. Hi to everybody. Nice meeting you all. And now the floor is for the discussion.
Yes, if any question are there with the topic, please put into chat box so that madam will answer directly. I don't think, because so many things are already cleared. Some of your old students from India, they are saying hi ma'am and telling I am Fahim Khan from Muzaffarnagar. So they are very happy to see you, ma'am. Anyone is having any question? I'm audible, Shashank?
Yes, you are audible.
Yes, ma'am.
Okay. Jasmine is there. Jasmine already joined. Jasmine, you are there?
Yeah. Good evening, ma'am.
Thank you so much, Pera ma'am, for joining us and giving such a wonderful insight regarding the evidence to practice and filling the gap in between. Thank you so much. You came with all the data and very clear picture how we can minimize the gap and how the nursing professionals organization can work on it. Before I request to I request Shashank, there is Rosalind madam is already in the box and she said she was unable to unmute that time. So kindly unmute our today's chief guest. Madam wanted to share some few things regarding the nursing profession and the theme.
Good evening, all.
Good
I
evening,
hope
ma'am.
I am audible.
Good evening.
I'm
Good
sorry.
evening, ma'am.
I joined
evening,
little
ma'am.
late and I could not unmute myself. So the speaker of the day, Miss Prema Balusamy, and the esteemed guest and the organizers who are present over there. Very happy Nurses Day to you all. So we have so many sessions. I heard, I listened to Jitendra also. I listened to Sujita ma'am also. And really, we feel proud to be here, to see the nurses are coming up. The nurses are standing for the nursing profession, especially the UP-TNI group, the state TNI organization. They are doing much thing for the nursing profession, and we feel so good for that. And of course, if we talk about the nursing theme of this year, it is everyone talked, it is caring for nurses, strengthening the economies. Of course, ma'am, in the speaker of today, she told we have to take care of ourselves first. Definitely, ma'am, I do agree with you, because we think, okay, I'm caring for my patient, but no one is taking care of me. But being nursing professionals, we should stand for ourselves. That may be for our wages, that may be for our working hours, the burden which we are having in this our profession, the workload, everything. If we stand ourselves, first we will stand ourselves for this profession, people will definitely listen. And if I say, if we can see the growth of nursing, even I am in this profession since 35 years plus, so I can see the drastic change we have in this nursing profession, where we started only with the sympathy, empathy, commitment and dedication. But now we can see the nurses, they are well organized, they are well planned, they are using all the digital technologies, and they are in front of everything in the health profession. And also we knew that during that pandemic, we are recognized little more because people never thought of nurses maybe, but during this period we got the recognition, the rewards, people recognize the importance of that backbone and heart of healthcare. So we are appreciated. Now it is our turn to stand for us, because we need to have that burnouts to be reduced. We need the workload to be reduced. We should always help the nurses who are coming up, the students. Of course, we all know that we are focusing on the training, development of the nurses. But when they go out to the clinicals, when they are working, they find it very difficult to adjust there because of the environment they are having, the mental health issues they are facing, even their physical health. So if we take care of them, there will be definitely the turnover will be reduced because the nurses will stay back. And also, like ma'am told, like they will stay back, the patient care will be effective, they can take care of the patients very effectively, it can reduce the cost of the economy, the nation's economy, we can contribute for that. So happy nurses day again. I am so sorry joining late, but thank you, nice to see you all. And Deepti ma'am, I must always, I am an admirer of yours. She is
Thank you so
always
much, ma'am.
planning, and she is always planning for the development of the nurses and the nursing profession. Every time she tried to organize some events so that the people can get together, gather together, and they can work something. Because now when we meet together, discuss something, people will have that idea, okay, she is doing this, why don't we do this, or why don't we contribute for that. So it is a very good initiative she is taking, and I am really an admirer of yours. Thank you,
Thank
Deepti,
you.
for giving me this opportunity to be here for a few minutes.
Thank you so much, ma'am. And you are our means you are very much to just like a senior. You are just elder sister, and always you. Just I said now before you joined, I said there were some colleges like the our dream colleges. So Sara is one of the that college, and you worked so hard in Sahara, and now it's become the Max College of Nursing. Maximum who are here in this. The webinar series, though they know you very well. Even the Jiten sir is there,
Yeah,
he worked
suppose,
with you.
yeah,
Yeah. Santosh
yes,
Indi sir, he knows you.
yeah,
So you are a
yes.
well-known
True,
personality in
true,
nursing
true, right.
profession. Yes. So
Great
Jiten,
participant. You are also
Yeah,
very great because last
yeah. Hi,
2 3
Jiten.
days ago,
Last week I called, no? Yeah.
actually Lucknow is now shining because of this supply. Always
no, no,
shining.
not like that, not like that,
It's
sir.
active. Definitely, Jitendra, I agree with you.
Yes, yes,
No, no, no. All are together. We all are together. See, what
Yeah.
is the means purpose behind the TNI UP? We wanted to take all the topics which are very hot in the market regarding the nursing profession. We wanted to take those all the topics in a screen. So this is our first step from TNI Uttar Pradesh. We will definitely take all the scenarios, all the topics, all the problems, all the solution on the screen, and we will like I will just request every one of you, all the leaders in the nursing field, please join with us and give us, just make us motivated, suggest us, give some your views that where we have to work in this field. So I'm always thankful to you, Rosalind ma'am. You are always available for me in all the programs, whatever we are organizing, either personally from the Samarpan, personally from the Rama, personally from the any college, and together as a team in the TNIUP. You are always being a motivator and partner in all the scenarios. Thank you so much, ma'am, for present here today as a chief guest. We missed your voice in the
Thank
beginning,
you.
as you said that you were unable to unmute,
Yeah.
but no problem. Now we can see that our Rosalind ma'am is in the screen. Thank you so much for joining. Thank you so much, Jitendra sir, being a star guest of today. Thank you, Sucheta Roy Didi. And thank you to our Santosh Indi sir. He is now means a bomb-like leader in the Karnataka. So now we request Professor Dr. Jasmine Manu. She's a principal and dean College of Nursing, Rama University, Kanpur, and she is our SNA advisor in national the state SNA advisor from TNI UP. I request you to present the vote of thanks to all the leaders, all the speakers, guests, participants, and definitely to your team. Thank you so much, ma'am. Thank you so much, sir. Now, the next voice is from Professor Dr. Jaspreet Mani.
Good evening to all. Am I audible, ma'am?
Yes, good evening, Jasmine.
Okay. So, Jai Hind, it gives me a humble of gratitude and great pleasure. I'm expressing the vote of thanks for today's international webinar series. This organized by our TNA UP State Branch. I'm so proud on behalf of Faculty of Nursing, Rama University, along with Samarpan Institute of Nursing, and our collaborative partner of DNipCare. So this is our fourth session of our international webinar series. On behalf of entire team, I express my heartfelt gratitude to our today's chief guest, Professor Rosalie Nirmal Madam, Principal, Max College of Nursing, Lucknow, for her gracing this occasion and her thought-provoking, blessing message to entire team of Uttar Pradesh, and sharing such an enlightening thoughts. It's really true, it's truly enriching today's session. And special note of vote of thanks to our today's guest of honor, Dr. Santosh Indi. He is presently working as a principal in BLD College of Nursing, RGHS. He's a premier Senate member of current RGHS in 2024. He got elected. He's a real veteran from RGHS Karnataka, and he just inspired with her thoughtful points. And you have to take some of the points that is truly in need in our current scenario. Special thanks to Santosh sir, and I'm so proud and to give thanks to Professor Jitendra Singh Shekhawat, HOD, and he is professor in TMU College of Nursing. I'm so thankful to you, sir, for your insightful words and your gracious presence in today's international webinar series. Again, next I would like to thank and congratulate Mrs. Sucheta Roy. She is presently working as an assistant professor, Government College of Nursing, Tehri, Uttarakhand. So she is really motivated us for today's international webinar series during our inaugural session of today's. So really thankful, ma'am, for connected with us today in this short notice. Thank you so much once again. And, we are very deeply honored with us are today's keynote speaker. So I'm not a person to introduce her. So she is a very well-known person, and especially in Uttar Pradesh. Might be she is not knowing us, but we are knowing her very clearly. That is our Dr. Prema Baluswamy, ma'am. She is presently working as an assistant professor in College of Nursing, University of Belhari, Batin Kingdom of Saudi Arabia. So about her, I don't want to say anything because it's already have a big introduction by Dr. Deepti Shukla, madam. But regarding her session, it was really, she dealt the session very brilliantly. This is a current scenario, how the evidence-based practice going to, it will be practically doing well in our current scenario. Many of the times what is happening, many of the conditions already she already explained it, but my point of time, I just telling you this evidence-based practice today's session, she made another one more responsibility to our TNI UP state branch. So meantime, we have not started with any of the, like ABP training sessions for our UP nurses or to the student nurses. Definitely, you given another one additional responsibility to our team. So definitely, we will look forward for this. So really, your presentation is it's like heart touching to each and every executive members of TNI UP state branch. Really, you given a guidance and direction for how to move forward in upcoming years. So regarding your presentation, ma'am, really you done it in a brilliant way, and many of the responsibility you assigned to us, definitely we will try to be the best. All the time we will do the best, but try to be perfect in every of the success. And thank you so much once again for joining with us. And in the short notice, that is very important thing. We are blessed today along with you. on this auspicious day of International Nurses Week celebration, and pay a great tribute to our Florence Nightingale. Along with that, entire TNA UP state branch, especially our president ma'am, vice president ma'am, secretary ma'am, and all the executive members and organizing team, and technical support. Those are timely connecting each and everything without any hinders. We are continuously doing this international webinar series. So thank you so much for your kind cooperation and seamless coordination. Last, again, this is for the hats off to all the participants, directly, indirectly, those who are connecting through the Zoom section today also. Many of the faculties, senior nursing officers also connected here. For everyone, big heartful thanks to everyone on behalf of, Uttar Pradesh State Branch, TNAI. Let us take forward today's all the sessions, whatever you gain today, again with the same same transformation, same inspiration for the upcoming last hour closing day on 13th May 2025, with our concluding remarks of international webinar series, because tomorrow is Sunday and 12th May, you know very well, we all celebrating International Nurses Day in your own institutions and all the professional bodies. So we should not give any other session virtually. With the huge respect, we are not conducting any of the sessions. We should not interfere any of the institution policies. So that is the reason we are not conducting on 12th May, but very next day on 13th May afternoon session, we'll have a closure day. So we will meet again. Thank you once again. Jai Hind, stay safe, stay committed, and stay tuned. Thank you so much.
Thank you so much, Jasmine. I request all the EC member of UPTNI, please open your videos. As we have our president today, Mrs. Kumudini Mishra Madam, she is our president. I myself as the vice president. Mrs. Bhumika Singh, secretary. Sister Prabha, joint secretary, she is here in the screen. Mrs. Pragya Singh is a treasurer. Dr. Jasmine Johnson, SNA advisor, जिनको भी आप सुन रहे थे. Miss Ashu Yadav, chairperson membership committee. Mrs. Lakshmi Pandey, chairperson program committee. Mr. Rahul Sharma, chairperson nursing services section. Professor Praveen Prakash, chairperson educational committee. और हम आपको बता दें कि हमारे आज के स्पीकर्स के एकलौते भाई भी हैं. सो ये प्रेमा मैम के ब्रदर हैं, हमारे अपने पार्टनर TNI के हमारे प्रोफेसर प्रवीण सर हमेशा क्राइसिस में हम लोग के साथ खड़े हैं, मदद करते हैं. Mr. Rakesh Pal, chairperson public health nursing section. Mr. Jaipal Singh, chairperson economic welfare committee. So here you can see our team is there on the screen. So I thank each and everyone. And Shashank Garg, you can open your video. He is our technical partner, assistant professor in Samarpan College of Nursing. Madam Associate Professor Manisha David, she is taking care of all the classes. Their students are in the class. Here in the Jasmine College also more than 3,000 students in the class. They're listening regular classes. In the Sahara or a Max College of Nursing, all the students are listening all the classes. Like this, there are many colleges that are giving all the is benefited of this webinar series. So I thank each and everyone for presenting today in this webinar series 4th day. And as Jasmine mentioned that we will not take further 2 classes. On 3rd, I again will mention that the 3rd, our national president and national secretary general, both are coming. Dr. Annie Madam and Professor Kannan Ma'am, both are coming to Lucknow. And we have our executive meet in the physical mode. So we will start our class session at 3 o'clock. So just request to each and everyone, please join on 13th at 3 o'clock to the classes, that may be 3 to 5, because yes, we will be busy in the morning section. Thank you so much. Though the condition is like war condition, and our so many people, so many nurses, I already mentioned in the beginning that they are on the borderline. I request each and everyone, along with your praying for yourself, your family, your society, please pray for all the medical personnel who are working 24/7 for nation. All the people, all the soldiers, सबके लिए will pray, will say that they must be safe and ये जो situation है जल्दी cover up हो जाए. From TNI, we will be always supporting to them whenever we are needed. We'll definitely be present. Thank you so much, everyone. Stay safe, be healthy, take care. Proud to be a nurse. Always make yourself proud in front of others to be presenting yourself as a nursing professional. Thank you so much. Take care. Have a good evening. Bye bye. Jai Hind.
Jai Hind to all.